Hi, today we'll be discussing about sexually transmitted diseases in microbiology. So these sexually transmitted diseases, they can either produce local manifestations or the systemic manifestations. So the causative agents which are causing local manifestations in both the sexes, which involve the genital ulcerative diseases, it includes syphilis, chancroid, genital herpes, gonorrhea, and lymphoma venereum. The systemic manifestations such as the HIV, the hepatitis B and hepatitis C. These are the group of diseases or the group of agents which cause the systemic manifestations, and these cause the genital ulcerative diseases. Coming to the urethritis. Urethritis is something that is present both in male and as well as the females. It is caused because of gonococcal urethritis, non-gonococcal urethritis, and etc. So today we will be discussing about the urethritis. So what is urethritis? Urethritis, as the name says, the urethritis is the inflammation of the urethra. So the causative agents of this urethritis. So the urethritis is most commonly caused by the gonococcal. What is this gonococcal? It is the Neisseria gonococcus, which is a gram-negative. It is a gram-negative cocci. So the Neisseria gonococcus is the most common causative agent for the urethritis. And apart from gonococcus, what are the other non-gonococcal causative agents which are causing urethritis? They are called as non-gonococcal urethritis causative members. It is also called as non-gonococcal urethritis. So the non-gonococcal urethritis is caused by various group of members. Example, in case of bacteria, the most commonly it is caused by the Chlamydia trachomatis. So this is an important thing that you have to learn. And next, coming to the Mycoplasma hominis. These are the group of viruses, bacteria. And coming to the viruses, in viruses, the HSV, that is the human simplex virus and cytomegalovirus. And in fungi, such as the Candida albicans. And then parasites, such as the Trichomonas vaginalis. These are the group of agents which will cause urethritis apart from the gonococcus. So hence they are called as non-gonococcal urethritis. So these are the agents which causes urethritis apart from the gonococci, and the urethritis that is caused by these group of agents is called as non-gonococcal urethritis. So today we will be learning about the urethritis. So urethritis is important question where you have to read both about the gonococcus and as well as the chlamydia, which is an important question. Today we will be learning about Neisseria gonorrhea. So Neisseria gonorrhea. So gonorrhea is caused because of Neisseria gonococcus. This Neisseria gonococcus is a gram-negative cocci. It is a gram-negative cocci. So first let's describe about its morphology. What is the morphology of Neisseria gonococcus? So gonococcus, as the name says, it is a gram-negative cocci. And how does it appear? How does it appear? So it is a non-capsulated. It is non-capsulated and it is a diplococci which occurs in pair and which is in kidney shape. It is kidney shaped and it appears pink when we see in the neutrophils. So if suppose this is a neutrophil, so you see the segmented, nucleus in that. And then you see this kidney shaped gonococci which keep appearing in pink, such as here. You see it. So this is a neutrophil and you can see the gonococci occurring in pair. So this is the gram-negative coccus. So Neisseria gonococcus. It is also called, it causes disease which is called as gonorrhea. So what is its morphology? So it is non-capsulated gram-negative cocci which occurs in pairs, appear pink when we see under the microscope, which is diplococci, and it is a kidney shaped. So what are its virulence factors that keeps it surviving and causing urethritis? So virulence factors, coming to the virulence factor, it has pili or the fimbriae. If you see under the microscope, this gonococci, it also has pili which keep appearing like this when you see under the microscope. So this pili, it is an important virulence factor because when you see, keeps attaching to the urethral and the other uroepithelium with this pili. It keeps attaching to them so that during the urination, during the outflow, it doesn't move out. It doesn't come out or it does not flush out. during the urination. So it is one of the main important virulence factor. It helps in adhesion to the host cells, so not get washed out during the maturation. And other things such as the outer membrane proteins. So outer membrane proteins, it has two proteins. It has porin. It has a porin, and as well as it has the opacity associated proteins. So what is this porin? Porin is a transmembrane channel. If this is a plasma membrane, and they act as a transmembrane channels. And these porins are again of two types, 1A and as well as 1B. The 1A, it helps in causing both local and as well as the disseminated manifestations, whereas the 1B, it causes only local manifestations. Next, coming to the opacity associated proteins. These opacity associated proteins, they help them in adhesion to the neutrophils. So as I said here, they help in adhesion into the neutrophils. Next, other virulence factor, it includes such as the IgA protease. So what is this IgA? It is the immunoglobulin. So the immunoglobulin A that is secreted by these uroepithelium, which is present in the mucus secretions of them. So this IgA, it provides immunity, it fights against the bacteria. So in order to prevent that, the gonococcus produces IgA protease. So it digests the IgA, which is secreted by the mucosal cells of the genitourinary tract. Next, coming to the endotoxin. So this endotoxin, since it is gram-negative bacteria, as we know, the lipopolysaccharide of the other gram-negative bacteria, it itself acts as an endotoxin. But here, in case of gonococcus, it does not have a polysaccharide. Rather, it has a oligosaccharides. So hence it is called as LOS, which acts as an endotoxin. Just like the Neisseria meningitis, it also causes endothelial damage. Next, coming to the clinical features. So the clinical features, it may be different in different sexes. So first, coming to the male. In the male, it is presented as acute urethritis, and this acute urethritis is presented as purulent urethral discharge. So there will be a purulent urethral discharge, and it will be within an incubation period of only 2 to 7 days. So this infection that is present along the urethra, it may be even infect the surrounding the periurethral space and causes an abscess formation around the urethra, and this abscess later forms into the sinus. So initially there will be an abscess, later there will be a sinus formation, and thus drain and causes discharge towards the outside, and this phenomenon is called as water can perineum. If this acute urethritis is untreated, then it causes other manifestations. It may disseminate into other parts of the genitalia. In case of male, it causes prostatitis or epididymitis. So coming to the female, in the female, as you can see, initially it causes, as it ascends upward, initially it causes mucopurulent cervicitis. So how it clinically manifests the mucopurulent cervicitis. This mucopurulent cervicitis is manifested as scanty vaginal discharge. This scanty vaginal discharge, then later it causes vulvovaginitis. Vulvovaginitis is something that you only see in case of, either pre-puberty or in case of old age. Why? Because in case of adult female, in order to protect from the infections, they have a acidic pH. They have a good acidic pH. This acidic pH inhibits the growth of bacteria or other infections. And at the same time, they have thick layer of stratified squamous epithelium, which helps them to provide resistant against the infections. But in case of pre-puberty and as well as the old age people, old women, there is no acidic pH or thick layer of epithelium, due to which it causes vulvovaginitis only in case of pre-puberty or in case of old females. And if this is untreated, it may spread into endometrium or to the fallopian tube, or sometimes it also called as pelvic inflammatory diseases, which causes sterility in them. there is a phenomenon which is called as Fitzhugh-Curtis syndrome. So what is this Fitzhugh-Curtis syndrome? So as I said, if it is untreated, it ascends upwards, the fallopian tube, endometrium, and then it may pass into the peritoneum. And then from the peritoneum, it may go into the liver and causes perihepatic inflammation. So this syndrome of where you find the peritonitis along with the perihepatic inflammation is together called as Fitzhugh-Curtis syndrome. Now, as we now read about what are the clinical features you see in male, female, and now coming to the features that you see in both sexes. So in both sexes, you can see there can be development of anorectal gonorrhea. So what is this anorectal gonorrhea? You see it occurring when there is an anal sex, or it may be pharyngeal gonorrhea. Pharyngeal gonorrhea you see when there is orogenital sex, or you can see the ocular gonorrhea. Next, pregnancy. So when a pregnant woman gets infected with the gonorrhea, what are the symptoms that you can see? You can see that there is a rupture. There is rupture of the membrane. There is chronic rupture of the membranes of the womb of the pregnancy. As you know, the membranes of the pregnancy, and there can be sepsis in the infant that is born, or there can be premature delivery. So these are the features that you can see in case of you can see these clinical features when a pregnant woman is infected. Next, coming to the neonates. So neonates, when the neonates that are born, they may be presented with a ophthalmia neonatrum. So this is a sign, this is a symptom that you can see, where you can see there is a purulent eye discharge in the neonate for approximately 2 to 5 days after born. So these are the clinical features. And coming to the last clinical feature, that is the disseminated gonococcal infection. So this occurs when the bacteria gets disseminated into the blood. So then we will call it as bacteremia. This bacteremia, it then reaches into various organs such as the joints. When it reaches into the joints, it causes polyarthritis. If it reaches to the skin, it causes dermatitis. And if it reaches to the heart, it causes infection in the endocardium and causes endocarditis. These are the clinical features. So it causes features in male, features in female. It may have common features in both the sexes. When a pregnant woman gets infected, when the neonates get infected, and when it gets disseminated. These are the clinical features. Next, coming to the laboratory diagnosis. How do you diagnose a person who is suffering from gonorrhea? So, first, the most important thing in diagnosis is having a current specimen collection. So, what is the specimen collection that happens here? So, you can either take urethral swab or the cervical swab. It occurs, it's not the cotton swab, rather it is the rayon swabs, because the cotton may not be an ideal thing for the Neisseria gonococcus. So we take the rayon swab and then transport. Generally, after taking the swab, the specimen collection, it need to be immediately sent to the lab for the further process. But if there is any delay, it has to be stored in the Stotz medium. What is the Stotz medium? Stotz medium is a charcoal medium that is used for charcoal coated swabs, or you may use the Mbbsmadeeasy medium. What is this Mbbsmadeeasy medium? It is a charcoal based medium. You can either use any of this Stotz medium or the Mbbsmadeeasy medium for the transport. After transporting it to the lab, under the direct microscopy, when you stain it with the HND, and then you can find that there are, as I said, a morphology here. How does it appear? It appears as pink, paired, kidney-shaped diplococci, gram-negative bacilli. So you stain it with gram-negative, gram staining, and then you can find that it is gram-negative. And then after direct microscopy, you can go to the culture. So culture, for the culture, we generally use the endocervical culture. So what is the selective medium? We use the selective medium for the Neisseria gonococcus, and that is Thayer-Martin's medium. So what is Thayer-Martin's medium? It is nothing but the chocolate agar with few antibiotics. A chocolate agar with few antibiotics is called as Thayer-Martin's medium. Or you can say modified New York medium. The modified New York medium. So these are considered as the selective media for growing the Neisseria gonococcus. So selective media is something that is used in order to grow only a particular bacteria and do not allow other bacteria to grow. So in case of Neisseria gonococcus, we use the Thea Martins medium, which helps only growth of gonococcus and no other bacteria. Next, after culture, you can do the culture smear. Again, in the culture smear, you can again gram stain it, and then you find the same features of pink, pale, kidney shaped diplococci, etc. And motility, they are non-motile since they are coccus, they are non-motile. Next, coming to the identification. How do you identify? We have two types of identification: conventional biochemical test and automated test. Conventional biochemical test. So in case of conventional biochemical test, we generally do the catalase oxidase test. So here it is catalase positive, which is catalase positive, and oxidase positive. And when you do the sugar fermentation, it is only the glucose fermenter. It is only a glucose fermenter. It is a maltose non-fermenter, which differentiates it from Neisseria meningitis. So Neisseria meningitis is maltose fermenter, whereas Neisseria gonococcus is maltose non-fermenter, which helps in differentiating both the things. Next, coming to the automated identification. This automated identification systems, it involved MALDI-TOF and as well as the VTEC. Coming to the molecular diagnosis. This molecular diagnosis we will use NAT. The NAT is nothing but the nucleic acid amplification test. So these help in amplification of the nucleic acid. So what do you use? We use the PCR, that is a polymerase chain reaction. Through the polymerase chain reaction, we will help to identify the 16S rRNA or the 23S rRNA. So by this is how you can identify the various virulence factors. These virulence factors causing various clinical features, and these clinical features, and then later we can, through these clinical features, it help us identifying whether it is gonococci or not, and then we can do the laboratory diagnosis by various procedures, and then finally you can get diagnosis of whether it is gonococci or non-gonococcal urethritis. So as I said here earlier, the urethritis, the most commonly it is caused by gonococcus. Apart from gonococcus, other things such as the Chlamydia trachomatis, Mycoplasma hominis. You can use HSV, you can either by HSV or CMV, fungi such as the Candida albicans, parasites such as the Trichomonas vaginalis. So what is the treatment? What is the treatment? The treatment here that we generally use is the third generation cephalosporins such as the ceftriaxone or cefixime. These two can be used for the treating of the gonococcus, and there is no treatment, there is no vaccination. There is no vaccine for treating the gonorrhea. I hope you understand. Thank you.